Hello, my friends. It's Andy over at today's CBD Oil, coming to you from my personal page. And the other day, I shared why I use my personal page and not the today's CBD Oil Facebook page, is because I feel like I have more of a reach, and I have an obligation to my friends and my family to share with you this great information that's coming through. The one thing I want to make sure is that my mic is working, but because for some reason, Dr. Kaylea can't, well, I call her Dr. Kaylea. That's not her. That's her first name. But I just want to make sure that you guys can hear me. So I know there's an 11-second delay. So if somebody could just go ahead and write into the comments that you can hear me or you can't, because that would be a bummer if you can't hear me. And so as usual, this would not be an Andy show if there wasn't some type of tech issue or something that went wrong. So that's just the way things roll. But before, oh yes, okay. So Kristen can hear me, great. All right, so it must be on the other end, and that's just the way things go as we're getting into this new technology. And of course, it happens on a show that I've just been since last week, or actually 2 weeks ago, when I met this fantastic person. I have been just waiting on pins and needles to do this interview, because we shared a couple lunches together, and she just shared some information about her practice and what she was doing. And so I'm going to go ahead and introduce her, and then bring her on so that you can start to hear what she has to say about how she uses CBD oil in her practice. Now, the other thing you need to know is I've read this intro several times, because there's really big words. If you don't know, I'm actually just simply a retired police officer. So some of these words are not in my normal vocabulary. And so Dr. Kaylea Boutwell MD is a board certified specialist in anesthesiology. See, already in the first sentence. Surgical intensive care and interventional pain management. Dr. Boutwell is fellowship trained in pain medicine and procedural techniques through Cleveland Clinic, one of the top ranked pain hospital systems in the world. For nearly a decade, her independent practice has been devoted exclusively to the comprehensive management of acute and chronic pain syndromes. As president, yes, I said president, of the Missouri Society of Interventional Pain Physicians, and a board member at the national level of the premier professional community, Dr. Boutwell remains current on new technologies and pharmatherapeutic, that word. Hey, say it really quick because I can hear you. Pharmacotherapeutics. There you go. Agents in her specialty field, applying these medical advances to set her practice apart from the rest. Dr. Boutwell is, and I know I'm butchering her name, has been a frequently invited speaker on numerous regional, national, and international stages, speaking on a wide range of academic topics in the field of pain management. She hopes to educate not only through evidence-based information sharing, but also lively, interactive, and high-yield subject presentations. She hopes this and every presentation helps to benefit patients struggling with the impact of pain on their lives, as well as providers who have the opportunity to help. There's some people watching right now that have pain, and they are just can't wait to hear you. So I'm going to get through this. The doctor continues to serve her home community in Missouri, where she was born and raised. Outside of her clinical practice, her time is spent with her husband, who is also a medical provider, and her twin 2-year-old daughters. Now, I've read her resume. I don't know how she's has twin children and does everything she does, but here she is, Dr. Kaylea, Dr. Awesome, as I like to call her. How are you doing?
I'm doing great, really great. You did wonderful. That's a lot to get through, and I want to thank you for saying that you're on pins and needles, because I thought maybe I was the only one that was this excited about an opportunity to get this message out.
Now, you have no idea. For the last couple months, I've only been using CBD oil for about a month or 2.5 months, maybe 3 months now. And it literally has changed my life in a very short period of time. I've read many testimonials, and I've heard people tell me stories. I just got a text message this morning that somebody that I know has migraine headaches, has been having migraine headaches for most of their life. And she had an episode this morning, and she says, okay, I'm finally going to try the CBD oil that you gave me. It's been a week since I've given it to her, and she's been afraid to use it. And she texts me back maybe 2 hours later, and she says, I've had this headache all week and it's almost already gone. How does this stuff work? So we can get to that part. Tell us what your practice is now, and just give us a little bit more information about what your practice involves.
Absolutely. So I graduated from my fellowship in 2009. And since that time, as you mentioned, my practice has been devoted exclusively to pain management, which means that I direct protocols for medications and also physical therapy. I do surgical interventions for pain management, and of course, manage the dreaded opiates.
Yep.
Which really solve no problems, create more problems than they solve for most of my patients. And so when something like this comes down the pike, I just hope that I don't lose the level of enthusiasm that I still have, because it's still relatively new for us as well. Yep. And the fact that I just get rolling comments about how good these things are working for people, how well they're working for people. And I've actually used it myself, and it's worked great for me also. So that's kind of how the flavor of my practice right now. My focus is on improving patients' function. So rather than giving them medications that trade their pain for either feeling sleepy all the time, or not feeling like they're themselves, or not feeling like participating in life, or just having a host of all the other problems that come with either being in pain or doing what you have to do to treat it, this has created quite a solution for us.
Awesome. So what does a day look like at your practice? When you get there in the morning, are patients waiting out in the waiting room, and then you treat them? What's a day look like for you?
Yeah, sure. I'm happy to take you through that. Sorry if I pause a little bit. I can hear myself twice. So I'm like waiting for the second me to finish before I start my next sentences. So sorry if I'm hesitating a little bit.
No problem. Let me just let everybody know what she's doing is listening to me through my phone, because for whatever reason, she can't hear me from her computer. So there's just a little bit of a weirdness going on. So, and no problem. We just want the information you have to share. So don't worry about it.
Got it. I'll push through, I promise, because it's a very important message. So yeah, a day in the life of my practice, I show up to work, and either I'll spend the day in clinic where I'm seeing patient after patient. In a clinical setting, get to sit down with them, talk about all of the problems that pain is causing for them, and talk about all of the intricate solutions that we can come up with to address their pain from all different areas to get them feeling back to their highest level of function and happiness and participation in life. And my other days are spent doing procedures. So I would be spending more time in an operating room, implanting devices that modulate pain.
All right. And then one more time, I know that I read your bio there, but just tell us a little bit about who you are as far as an MD. And, I just want to make sure and give a little bit of background to make sure that people understand that this is coming from, this information you're going to give is coming from a place of an expertise in what it is you do.
Absolutely right. I think that's a really important point, because I am a traditionally trained interventional pain management physician, which means that, as my nephew was funny enough to say, I graduated from 28th grade. So that made me feel young, as you can imagine. But so, yeah, I mean, college, then medical school, then residency, then fellowship, and all of it was following that very traditional trajectory of Western medicine. So I was trained with mainly all of synthetic pharmacotherapeutics, and the idea that we are basically illness doctors that respond to pain and problems as opposed to heading them off, or as opposed to trying to actually improve the health of the tissues so that people feel better, rather than understanding that people have pain and trying to find some way to cover that up. So Absolutely traditionally trained, and now open to this idea of working from the ground up.
All right. So when did CBD oil come into your view, into your radar?
My focus of awareness.
Yeah.
So really, I started opening my mental horizons when I had my own back injury. In 2011, I was on a rowing machine. I sure wish my injury had been sexier than that, because there's a lot of cooler ways to get hurt. But I wasn't even rowing a boat. I was just in a gym, 6 o'clock in the morning, and ruptured 2 of my discs in my low back. So I went from being 32 to feeling 800 in about 5 seconds, and had to spend an entire year rehabbing my back. And the interesting thing was that even at that time, I felt like I had been changing lives for quite some time with the treatments that I was providing. But I didn't recognize, even through compassion, the fear that comes with hurting that way, and the uncertainty of, is this it? Is this my new normal? Mm-hmm. Am I going to be the person who has that surgery that only makes them worse, that I've been treating for years already? And so I think I just looked at the whole thing in a much more broad sense. So I brought in the tenets of nutrition, lifestyle, mindset, sleep hygiene, and a more natural approach to really getting better and wondering if that injury wouldn't actually be a way not only for me to actually be better than I would have been in the long run, but if I could be a better doctor than I ever would have been, because I could relate to those patients on a whole other level. Right. So I brought in all those other facets, a much more comprehensive approach to care. And I started just listening to people who were like-minded. So I got into sort of the podcast threads of people, JJ Virgin, Dave Asprey, a big biohacker, bulletproof fan. Mm-hmm. And was both literally and figuratively drinking the Kool-Aid, drinking the bulletproof coffee, so to speak. And so I think it was really through people like that who are actively living day by day to find better solutions for really big problems that I became aware of CBD oil.
So then you start taking it yourself. Is that correct?
I did, actually. So after I listened to a podcast that was actually about a 30-year Army veteran working at Walter Reed who had designed his own CBD oil as part of the standard protocol for treating military veterans who were coming back with PTSD and closed head injury. And all of them were having remarkable results, so remarkable that they were making a standard part of their treatment by using CBD oil as a key part of their plan and treatment. So I was very impressed by that and really decided to do a lot of deeper research, and obviously bought in several products actually and started using it for myself. And why that was important for me too, as you can imagine, is that, the days that I was describing to you before, if I'm in clinic, I'm face to face with a patient. Their well-being is up to me. I have to develop a comprehensive plan that's clear. I have to be concise and comprehensive with them, develop a plan for them that they believe and trust in and can move away with confidence. I can't be fuzzy-headed, which means I also can't have the type of back pain I can have because of my injury history, like my pain standing between me and being able to help them, or taking a medication that would blur me in some way either. And then the other days that I was talking about before would be in the operating room, right? And so clearly if I'm, putting harpoons in people's spines under x-ray guidance, it's not wise to do that when you might be off your game a little bit. So I needed something that would allow me that kind of pain relief, but being very, very clear.
What's interesting, you just brought up something that I didn't think about before, is that a doctor coming out of medical school that has just had a healthy, blessed life and never been in trouble, medically, operating on people, may not have the same perspective or point of view until they've gone through something serious. And I'm wondering how many doctors go through that oh yeah, it's okay, you're going to be fine. But then once they go through it, that changes their bedside manner, so to speak, that they completely change the way that they think about their patients and maybe be a little bit closer to them and understanding their pain and discomfort.
Yeah, I'm sure that there's some very talented practitioners out there that do a great job one way or the other. I would like to think that I did before it happened. It wasn't with the level of attentiveness and relatability that I have now. And what makes me really I don't just ping when I see something new. I need to figure that out. And I need to know if that's something that can help me and me help my patients.
Right. So when you started using or taking, or I don't even know how to say it still, is because using sounds bad. It sounds like taking an opiate or using an opiate. Yeah. When you started using the dietary supplement known as CBD oil, how quickly did things start to change, or did your body respond right away, or did it take some time?
So, for me, actually, it was a little bit more like most natural things happen, which is, like I tell a patient, if I tell you to go, to increase your level of exercise and you go to the gym, day A and day B might not look that much different from one another, but day A and day Z may look remarkably different, right? And that's the way natural things happen. You start, using good nutrition, and again, day A and day B, but a month later, you dropped 15 pounds, your skin looks clear, your eyes are brighter, you're sleeping better, you've got more energy. Yep. For me, that's how CBD oil was. So I needed to stick with it for a little bit, but it was well worth it. I have other patients, however, and I was happy to see you use the photographs because this is great. The example that you had was a patient of mine who was already using his CBD oil for his back pain. And he was one where a dose and 2 hours later, he had not only that sense of pain relief, but also kind of that just comes with feeling like you had the spike take out of the back. And he started using it topically, which were the pictures that I shared with you because it helped him heal, like I say, like a Wolverine.
Yep.
He traumatically amputated 3 of the fingers on his left hand. And 3 weeks later, the hand looks like the injuries were 3 years old. And I'm a surgeon. I know what that looks like. 3 weeks later, traumatic amputation with a table saw in a garage, and it's completely healed.
Yeah, you know what? I'm going to share that those pictures right now, just so people
you should. Absolutely.
In case they missed it. It takes a little bit of juggling here because for whatever reason, BeLive doesn't recognize text messaging. But let's see if I can pull this up without.
Yeah, it was really remarkable.
Messing up our discussion here because it's important. And because this is obviously the first place I wanted to go with you is to talk about this again, because I think that it's almost unbelievable when you see here holding, maybe I can do this. This is not that easy.
Right.
Hold on.
As I was telling you before too, I hope that I never stop being as impressed with it as I am just by starting to get used to the fact that it works so well. Sometimes you're like, oh yeah, it always works. And you lose an appreciation for something that's really a workhorse. There you go.
Yeah. So they're seeing the hand as it looked when it was first done. And so that picture was like immediately following. And of course, there's something showing up right there in the middle of it. There we go. That's pretty closely to after it was done, that first picture.
Yeah. So that was when he presented to the emergency department. And what you can see actually is that the tip of the thumb is cut off on the side closest to us. Mm-hmm. And then if you look really closely at the ring finger and the small finger, and by the way, his wedding ring was never found.
Oh, no.
The table saw cut straight through it, and they still haven't found his wedding ring. So if you can see at the base of that finger, the ring finger, like where his ring would have been, that's a cut tendon all clean through. And the vasculature, which provides, blood flow to that finger and then the pinky, you can see that dusky, dark kind of gray appearance to the end of those fingers. Yep. Those fingers are not salvageable. So there would be no version of a repair of either the tendons or the blood vessels that could have saved those fingers. So this is actually one of the nicer pictures I sent you. It actually kind of put things back in their original anatomic ratios. Yep. Things were in different places before. Yeah,
well, number one, I should have warned people that these pictures were coming. I'm sorry. Oh. As I did on the broadcast, but too late now. But I did mention in my broadcast when I showed these pictures for the first time is how interesting it is that you were able to replace the thumb, but have to remove the fingers.
Well, so they were able actually to reattach the tip of the thumb. Yep. It was kind of done as a flap. So that he had enough viable vasculature or blood flow to keep that part alive. But yeah, the other 2 fingers were a no-go. Yep. So next. So you can see the sutures. Yeah, sutures there at the tip of the thumb, and the kind of the wonky suture lines they had to make to try and just get the skin to come back together in a way that would heal in his ring finger and small finger.
How much after the event is this picture?
So that would have been right after it was sewn up. So they would have had to take him through surgery, complete the amputation of those 2 fingers and close them with the suture.
So then we'll come down to this one here.
So this is about a week later.
A week?
Yeah, a week.
And he's 59, right?
And he's 59 years old.
Wow.
And yeah.
That is crazy. He's way older than me, but yeah.
Way older.
Yeah.
I assumed as much.
Right. All right. And we have this picture here. How long after the event is this?
So that's only about 3.5 weeks after the initial picture was taken. And you can see at this, what are called stumps. That also sounds like not a nice word, but that's, so at the edges where those incisions were are just completely healed. There's no acute, active, inflammatory appearance to that skin or tissues at all. And I actually saw him back in clinic about 3 days after that, which is where he gave me some more pictures. There you go. You can see it in that nice natural light.
Wow.
That's what an incision looks like months after an injury like that one, not weeks.
So let me go ahead and come back to my screen here really quick and get rid of that so that we can see each other a little bit better. So one of the things I talked about in my broadcast, and of course, I'm not a doctor because you could tell by the way I read your bio, is that I believe what the important thing about healing this quickly is that you'll have less opportunity to have infection, re-injury from bumping it and hurting it, getting dirt in it, and that kind of stuff. So there's a really awesome, I guess, that's not side effect, but result from having healing so fast and so good is that you don't have to have these long-term opening and stuff that can happen to it.
Right. That's a very meaningful benefit.
Yeah. And how about the pain? Was there any pain management because of the CBD oil, or just mostly for the healing process?
For this patient with this problem?
Yes.
Well, so actually, because it works so well for his back pain, and he uses it actually he has a tincture and also has the transdermal. So he sort of works from the outside in and the inside out. And because it works so well for his pain there, he actually was using it on the hand for pain. It was actually just as you said, kind of a meaningful yet unexpected benefit that the healing was dramatically accelerated.
Wow. That is awesome. I when you showed me those pictures, I couldn't wait to share with everybody. And so thankful that he gave us permission to be able to use those.
Absolutely.
And share with people.
And one other application, just because I think it's a really relevant one, is that many of my patients come to me because they have something called diabetic polyneuropathy. There's another big word for you, which just means that these patients with chronic diabetes have nerve pain in many of the small nerves that are in their fingers and feet. It's called stocking glove neuropathy. And the thing is that not only they have discomfort with that I think could be meaningfully benefited with using the CBD oil, either internally or transdermally, but also they typically have difficulty healing both foot ulcers and other types of cuts and bruises because of the damage to their tissues by the glycosylation or that sugar coating of those nerves. So again, I think that would be a really an important thing for someone to recognize. And maybe if they or a loved one has pain due to diabetes or has difficulty healing injuries in their peripheries because of them, I think this might be a really interesting consideration.
So I have a friend here, Martin, who's on right now. He had a serious motorcycle accident where he broke and his feet and ankles and legs. I mean, it was a mess. And
what didn't he break? What didn't he break?
Right. Yeah. Not a sense of humor because he was cracking me up in the hospital. We were laughing. And so in your practice in regard to pain, is there some level of pain that you would not recommend CBD oil for, or do you kind of what is it when your decision making behind suggesting CBD oil? Because I mean he had so much damage to his legs. Would this be even benefited him at that time?
Sure. Well, I think that because I consider CBD to be so much more beneficial in so many ways, there's not a contraindication to it that I'm aware of in any way. So I would put CBD oil in really on a ground level. And then whatever pain it sort of didn't touch, maybe some type of breakthrough pain or surgical pain, something of that level, then maybe on top of that, you're adding one of the more, higher powered synthetic, the Schedule II opiate type medication. So, your hydrocodone, which is called Vicodin, or oxycodone, just Percocet, Oxycontin, any type of fentanyl, morphine, anything maybe that might be needed IV. Something that's very, very quick acting, very, very potent. But I would try to reserve those things, and always do, for that really acute setting. So maybe while you're in the hospital still and managed by people who can watch you for things like respiratory depression. And one of the problems with those medications is that people stop breathing. They also get GI gridlock. Their GI systems shut down completely. And you have to be able to have a really close eye on those things. And with the CBD oil, those things aren't problems. So if you have CBD oil, in my opinion, sort of feeding the meter first, and then you can come in behind that with any of the other, physical therapy and the more synthetic medications that are more targeted. Wow.
I'm blown away. There's so much that you're talking about that I've not even on my radar. I've talked about blood pressure. I've talked about my sleep. I've talked about friends of mine that have migraine headaches that I've suggested it for, but now you're going into a completely different, again, that's part of my excitement of interviewing you, because I wanted to know more about what it could be used for. I've told my friends as much as possible that I feel an obligation to share this information with them, that they need to know that this is something that's out there that could help them. It's, again, I don't think that it helps, everybody 100% of the time. It's just like anything else. Right. And there's going to be some people that don't feel anything, right? But I've had enough people tell me, say that it has changed their life. The text message I got today, I've had this headache for all weekend. I just took 5 drops and it's almost gone. Right, is to me enough to make me get a little teary-eyed, because I know people that have migraines and it is miserable to have those migraines. So, yeah. Right. And so just now going into your hemisphere and hearing what it does on that level still amazes me that this thing is so controversial, that there's not more studies done on it, that when I have a friend of mine who tells me, goes, I'm a little concerned that you're doing this marijuana thing. And is saying, are you afraid that, what people are going to say about you? And the answer is no, I'm not, as a matter of fact. So what do you say about that? The stigma behind CBD oil. Do you see that in your practice?
Sure. I'd love to speak to that, because that is by far and away the number one objection that I get is, that people, they don't totally understand what it is and what it's not. And why wouldn't they, right? I mean, unfortunately, the prohibition on marijuana forever has brought naturally in with that a prohibition on hemp products, because they sort of look alike and act alike in some ways. And it has really prevented and stunted us from having growth in a very important area, in my opinion. So to speak, I do want to mention, you said, this doesn't work for everybody. No one thing works for everybody. I have managed synthetic by design medications for over a decade now. And if one medication worked for everybody, for anything, that would make my job really easy. I could probably pass it off to a monkey at that point. But there's an art to this science. And humans inherently have what are called pharmacogenetics, which means that they're going to have the machinery to process some stuff and not have the machinery to process others. Oh, that's good. Unfortunately, we don't walk around wearing the T-shirt that says, I'm gonna work through that one perfectly, and that one I'm not going to have the stuff to work through. So you just have to trial it. In fact, I've had some people try one type of CBD oil, and when it didn't work, they would try a different one and they would get an effect. So, and that makes some sense because again, of the prohibition, there's not as much standardization in a lot of the products, which is why it's very important to get something like HempWorks, your product, or some of the other ones that are really highly vetted.
Nice.
Now you've got me doing it, Andy.
I brought you down to my level.
That's funny.
All right, so, continue, doctor.
So now you got me. It was bound to happen. So using a non-GMO organic product that's vetted and properly harvested is actually incredibly important, because you're right, especially because no one person is going to respond to everything. You at a minimum want to make sure that you're getting a great product, because to not do that, you're wasting your money, you're wasting your time, and you're wasting an opportunity where you could have been moving forward and using something therapeutic, and instead you're throwing your money and your time away. So that's that part and piece of that. As far as the stigma, I'm really careful to explain to the patients exactly the difference between CBD and THC, especially because I would like to remind, the viewer, I am a pain management provider in the state of Missouri. So medical marijuana is not legal here, and it's not legal federally anyway. So the last thing that I can look like is that I have my hand in some cookie jar, right? So I had to be very, very clear that this is legal in all 50 states, that the THC, which is the psychoactive component of a marijuana plant, is isolated, right? So I think, if I'm not mistaken, the most recent standard was that there can be no more than 0.03% THC in something that's considered an exclusive CBD isolate. So I'm very, very clear to educate my patients about that and make sure that they feel safe and confident that they're not using something that has the intention of getting them high.
Right.
In fact, they tell them that that's what they're expecting. They're going to be disappointed.
Yeah.
I'm sorry.
The hippies' disappointment, as a matter of fact, is they call it.
I'm sorry. You're just going to have to settle for the dimmer switch happening on your pain.
Right, right. Yeah, that's all. Lower blood pressure, better
You're just going
sleep.
to have to feel better because you're back out in life again. You're having meaningful conversations with people. You're sleeping better, so you're spending that time at the fuel tank at night that you need to feel gassed up for your day.
Yep.
You're just going to have
That's
to
all
settle
good
for
stuff.
those things.
It's all good stuff. Before there's a ton of questions coming here, so I'm going to try to make sure and go back to some of them that are coming in. We're getting hammered, and that's good. That means people are watching, they're commenting, and everything is looking good. People love you so far and love your information. But now, because of all that, I've forgotten what I was going to say. So on the as healthy people. So the other day I was doing a broadcast and it dawned on me that whenever I do these, I'm talking about people with ailments and symptoms of other diseases that the CBD oil seems to have an effect on. And I began to think, well, wait a minute. This is for healthy people too, because the endocannabinoid system is something that needs to be kind of rebooted, kind of like an iOS system for an iPhone. And that's thanks to Matthew Adams, who suggested that. And that sounds like a really good analogy. But do you have any thoughts about that? That maybe this is something just like vitamin C, or I don't know what you believe in, but what other types of vitamins you should take? That this might be one also that you should take, even if you're healthy.
Absolutely. So even when my back is not flared up, I still take my CBD oil on a regular basis because there have been several studies that have suggested that the anti-inflammatory effects of the CBD oil are good for chronic use. So another supplement that I use on a regular basis is turmeric, which has gotten very, very popular. And all of the same sort of principles apply. You need to make sure that you're getting a good product that's, properly vetted. And
somebody already created a hashtag. I think it was Roy.
That's great. That's great.
I forget.
Always come back and remember that. But so, like I was saying before, our Western culture teaches us to be very reactive to disease processes. But what we really fail to think of is wellness medicine. How do we live our best for the longest? It's like cognitive enhancement. Yeah, there it is. Vetted. And I think, Rich, that's how it's spelled. Yes. Well done.
So back to healthy people.
So absolutely. I personally believe that there is a preventative medicine component to using CBD oil on a regular basis. So my personal approach to that is just a little bit, at least a few times a week. And then, of course, when my back is flaring up, usually because I've done something I knew I shouldn't be doing.
Like riding a horse?
Riding horses? Yes. Yes, I know. I'm a doctor. We're the worst patients. Do as I say, not as I do.
Let me share this really quick, just so you know she's a real person and not a cyborg of some sort. There we go. Hold on. I got to share this picture. Make it solo. Sad that I have to do all this extra work here. There you are.
Yep.
That is nice. A champion too. You're right. You're a champion in your event.
That's correct.
Look at you. Enough about you. Let's get back to me.
Okay.
All right. All right. So you ride horses, and that obviously can flare up a back injury and that type of stuff. So those of us that like to be active, I still like to play hockey. I still like to get out there with the kids and lift them up and throw them up in the air. And I did a Facebook Live yesterday. I tore a muscle here in my bicep during a CrossFit competition thing. And I've not in the last year, I've not been able to even pick up like last night I said a beer, but a drink of water because of the pain was excruciating.
Are you sure it wasn't a beer? I heard
but
beer.
Yesterday was back to being able to pick up 35-pound dumbbells and do a curl and do a shoulder press with no pain. And I don't understand it. And you do, because you're a hell of a lot smarter than I am. But it makes no sense that this injury that I've tried everything. I tried the ibuprofens and the other pain medications and things, and nothing took it away. Not to the point that I could work out. Right? It just always hurt. And then yesterday, here I am. I wanted to do it live on Facebook to show that I can do this now, and I've not been able to do it.
So now, did you use it transdermally, locally in the area, for like a targeted tissue treatment, or did you use it by mouth?
By mouth. I'm glad you didn't use a big word. I know there's a big word for that too, but lingually or linguistically. Now, how do you say it?
Linguist.
Lingua. That's a kind of taco. A taco that I had is lingua. But
Yeah. Oh my gosh.
You know
That's
what I
so
meant.
funny.
Whatever that's
I
called.
do. And I think everybody else does too.
Okay, I'm just kidding.
Yeah. So
I wasn't
sublingual.
kidding. I was serious. Real quick, and I don't know if you could speak to this or not, but drug testing with hemp low level THC, and they have one that they say has no THC.
Yep.
Do you know anything about that, or can you speak
Of
to that?
course.
Whether people can be drug tested and pass?
Yep. That's it. That is in my universe too.
All right.
So on a very regular basis, because of the type of practice that we have, in order to ensure patient compliance and safety, we do random urine toxicology screens. And I reassure everyone that I have explored the option of CBD oil that they will never come up positive on the urine toxicology screen for marijuana, which is illegal, because marijuana's psychoactive component is THC, and that is the only component that we test for on those tests, because it's the only component that matters. If they're using CBD, that would be like testing to see if they were taking an Advil, right?
Oh, wow.
So there wouldn't be like a concern about needing to know that. And for at least right now, one of the other reasons why we test is to make sure that we're not creating something in the chemistry set that's not good for the body. But CBD in a natural form is so what we call biocompatible. It plays so nicely in the sandbox with so many other things that we don't really need to watch out for it. And in which case we'd have to avoid other types of medications to avoid dangerous combinations. That hasn't been a problem so far. So to answer your question though, in my experience, I've had multiple patients who have had the CBD oil that the bottle will say that they had the 0.03% THC, and they've tested negative on the urine toxicology screens. Likely the level of THC that actually creates systemically just isn't enough to be detected even by a really good test that does like mass spectrometry, which is what we use. So if you're concerned about coming up, dirty on a drug screen or however they like to say it, in my experience, a good product like yours or the other ones that guarantee that they're not slipping you a Mickey, people don't end up with problems there.
Nice. All right. Here's a question about peripheral neuropathy. Did we already answer that or not? Can we maybe just address it again just to make sure?
Yep. Mm-hmm. So when I was talking about, so peripheral neuropathy is more of an umbrella term. I was talking about diabetic polyneuropathy, which is a form of peripheral neuropathy caused by diabetes. But there are lots and lots of disease states and pathologic states that can cause the pain in those small nerves of the hands and feet. And so, yes, that's how I've used that before. And I had one patient who was actually on a Schedule 2. So that's, this, you want me to speak very briefly about what schedules are?
Yeah, for sure.
So the DEA, as you know from being a cop, they schedule different kinds of medications. So like Schedule 1 is like heroin. So there's the risk to benefit ratio of that drug is so bad that there's no medicinal use for it. Schedule 2 is just below that, where the medications are basically the highest risk medications we know of, but that can still in the appropriate setting be used for benefit. So that's the Percocets and morphines and fentanyls and Oxycontins and Vicodins of the world. So,
okay.
So those are medications that have to be managed very, very closely because of the risks associated with them, even in very responsible patients. So I had a patient who had a peripheral neuropathy that was not diabetic. It was of a different type and was on a Schedule 2 medication for years. And when we found a CBD oil that worked for her, we were able to get rid of the Schedule 2 medication completely. And the off benefit of that was also that the constipation that she had struggled with for years because of that drug, but it was the only thing that she found that helped her pain. So the constipation and the sedation that she had with that medication, of course, went away completely when we were able to get her off of that. So not only is she no longer sleepwalking through her days, her bowels are also working properly, which is incredibly important because constipation is not just uncomfortable, it's incredibly unhealthy. It damages the gut lining. And I think it's really important to acknowledge that 80% of human serotonin, which is your feel-good hormone, is actually made in your gut, not made in your brain. So if your gut is offline for any reason, the way I describe it to my patients is if you just rate your happiness on a 0 to 10 scale, 0 is miserable and 10 is euphoric.
Yeah.
You can only get to a 2 if your body's not making the serotonin in your gut that it needs to make. So imagine 2 is not much of a life. So if your gut is offline because you're taking narcotics, then you're stuck at a 2 or 3, not a life much worth living. So we were able to get her out of that gutter, off of her narcotic pain medications, exchanging it for CBD oil, and life in general is just a much brighter, happier place for her now. And so you can see why I'm really passionate about helping talk about these things, because I want that for everybody.
No kidding. You just, I see a new Facebook ad, get out of the gutter, use CBD oil. Yeah. I'm taking that.
There's got to be, let's count on the hashtag coming up again, maybe.
I just created a new ad that says, cure. I'm not going to, never mind.
All right.
You'll see it. You'll see the ad. Yeah. I don't want to give it away because somebody's going to steal it and not show it. April saw it, and I think Matthew Adams. By the way, I've been thinking about this, Matthew. If you could do me a favor, if you're still watching, if you could put up the FDA disclaimer. I know that we've talked about a lot of stuff here, and I did not put that disclaimer up one time because I was a little too excited, and we were struggling to make this happen because of the sound issues. I have a question here with April. Do you still have time?
Me?
Yeah.
Oh, I'm all yours as long as I can.
My garage is opening.
What's going on there?
I know you thought that I was in some very expensive studio, but my daughter just opened up the garage door on me in my studio. Can you close it, please? Thank you. Wow. See, this is Andy. This is me. You're seeing me now. And the squeaking will start all over again.
That's great.
I promise my book will be
a classic right there. That's going on the reel.
Oh my gosh. Okay, well, a question from April Roga. She says, would it be recommended to not take stuff like Advil because of the fact that the oil, CBD oil, already reduces inflammation? What are your thoughts?
So great question. So my recommendations not to take Advil wouldn't necessarily be whether or not it was combined with the CBD oil. I mean, certainly if the CBD oil is already controlling the inflammation, then the Advil would be unnecessary. But I do just about anything I can to avoid having people take the synthetic non-steroid anti-inflammatories anyway. So Advil, Aleve, so naproxen, Dapro, meloxicam, diclofenac. So the list goes on, right? Any of the medications that are in that class, the most popular of which are ibuprofen, which is Advil, and naproxen, which is Aleve. Those are sold widely over the counter. The problem with those drugs is twofold, primarily. The first one is that it inhibits the enzyme in your gut that creates the protective coating that allows the gut to protect itself against the acid that's in there. So the reason a lot of people get what's the word for dyspepsia? That reflux? Reflux. So the reason a lot of people get stomach upset, nailed it.
Thanks.
With those types of medications is because those medications inhibit the production of that protective enzyme in the gut, number one. So that can not only cause discomfort, it can cause damage to the stomach lining and ulcers. Nobody wants ulcers. Right. So you're treating, joint pain with inflammation, but you end up with holes in your stomach. That's no good. The other problem with those medications is that they increase the risk of heart attack and stroke and other cardiovascular event. We think that because those medications are sold over the counter and they're so popular that they're not dangerous, but it's just simply untrue. So I always encourage my patients to eat an anti-inflammatory diet first and foremost. So don't put food in your system that's lighting those fires to begin with. And then trying more natural remedies. So certainly the CBD oil, turmeric with curcuminoids is a really good one too. So ideally, the idea would be that using those things and those strategies first would obviate the need for the Advil or the Aleve to begin with.
I hope you don't mind that I'm going to transcribe this entire interview, and it's going to be most of my book.
I'm sorry, you cut out a little bit there audio-wise.
I said I'm going to transcribe this interview. It's going to make most of my book.
Oh, terrific.
You're going to be a co-author on my book.
As long as they're royalties.
Sure.
I get paid plenty in karma. I don't need your money.
Okay, cool. You got good karma.
You have a job like mine where you get to make people well all the time. I'm good.
That's awesome. I had a question. I just had people responding that I had a full mass spectrometry.
Yep. Yes, mass spectrometry. Yeah.
And showed untraceable.
Right. So what he's saying there is that he actually he had the toxicology screening while taking the CBD oil, I'm presuming. And so it didn't detect it. And that's what I'm finding as well.
And then Matthew Adams said, I just had an accident about a week ago. I tested clean. So yeah, he didn't test dirty.
Right.
I didn't know how to spell diabetes, so I Googled the fancy words.
I'm liking this Rich guy.
Yeah, Rich is funny. Rich and his wife just started a CBD oil podcast. They're friends of mine who were watching my Facebook lives and got motivated, and now they're killing it. They already started their Facebook lives. They're starting a podcast, and he actually wants me to introduce you to him. So, and he's in St. Louis, and so
he's in St. Louis.
Yes.
Oh, with me, we'll have to get together.
Well, I may be jealous, so just be careful.
Don't be jelly.
Yeah,
work it out.
Just be careful. Have you had any patients with spinal stenosis who had success with taking the oil?
So actually, the patient that we were looking at his hand before, he was taking the CBD oil for back pain that was actually due to, he had a surgery that didn't correct all of his problems, but the problem it didn't fix was that he had spinal stenosis above the fusion. And so he was having both back pain and also some downstream nerve discomfort from those nerves being sort of crowded. And we've done several things to address that with him, but that CBD oil, he was taking that for symptoms of spinal stenosis and it was helping.
Wow. So do you think having it already in a system may have been helpful also in the healing, or do you think it was just specifically from the topical? I know that's probably hard to answer, but.
Well, yeah, I mean, that would kind of be an anecdotal thing to say. I would like to think so, especially because I choose to use CBD oil preventatively for myself. So that's the kind of evil spirits I'm trying to ward off, just exactly, But so if we think about, just to revisit that question about the spinal stenosis in the event that, kind of the big word thing again. So really, I mean, spinal, right? So we're talking about the spine.
Yep.
Stenosis is just kind of like a narrowing of anything. So if you just imagine that there's a big straw and a small straw, the small straw would be considered stenotic or stenosis. It's just smaller. There's less space inside, right? So if you have the same size contents, but the container is smaller, then you can imagine how the nerves inside there would have less room to sort of move about the cabin. And so that rubbing of the nerves irritates them, and the irritation can lead to inflammation. And then if those nerves become inflamed, then they're going to be like any other tissue on the body. When it becomes inflamed, they get swollen, right?
Right.
And so then not only is this small space already too small, now it's really too small because the contents have gotten even bigger. So if you can reduce the inflammation, the nerves get smaller, loses that swelling and edema in there, and then the container suddenly, or over time, actually becomes adequate again to contain its contents without them being actively irritated and rubbed inside.
Nice. Wow. April says, I need my own Kaylee in my pocket.
That's awesome. That makes me feel really good. In the pocket, or maybe like on the right shoulder, sort of.
Yeah.
And make sure to bring my little harp and the wings.
Yep.
Let's see. Unfortunately, I put a little red me on the other shoulder.
Great to see you guys. Everett. Oh, Everett's on. You met Everett over in San Diego with us.
Yeah. Hi, Everett.
Let's see here. What else we got? I'm really excited about you. Oh my gosh. I don't know what's going on with my little selection thing here. I'm really excited about using this for my son who is nonverbal and on the autism spectrum. He's got for sure.
So there's a lot in the nutritional space right now for addressing autism and understanding how everything starts in the gut. And if we can figure out his microbiome and figure out which switches to turn on and turn off, and CBD oil may very well be a useful adjunct to that, that's definitely worth exploring. And we can talk a little bit later, if you like, Andy, about I have some contacts to the JJ's community where we can share with April a couple of books in particular, an author that I like that might be able to really help her.
What I love about April is she it took a while. I've known April for about a year now, maybe a little bit longer. And she started watching these Facebook Lives about CBD oil. I interviewed her about her son and dealing with autism and during April, the month of April, with April. And She's had this information, and just the other day, she's decided to give it a shot to try.
Oh, she was the reluctant.
Yeah, because she had all the questions. Is it going to make me high? Am I going to want to eat Pop-Tarts all the time? Am I?
What's wrong with that?
Am I going to be able? Am I going to be able to?
And Captain Crunch.
Yeah,
that's what my parents fed me. That turned out just fine.
I ate tons of Pop-Tarts when So anyway, sharing. Rich Moore works for me. Andy, sharing is caring. At least that's what Schoolhouse Rock says. I love Schoolhouse Rock. It's one of my favorites. You know what School Rock? Never mind.
Oh yeah.
So I'm way behind on these questions. So April says mine is below my fusion.
Yep, below the fusion.
All right. Yeah, I'm glad you know what that means. Rebecca says I love CBD. That's good.
Good.
Jake, another friend of mine, Andy, please make this interview available to us on Facebook. It is on Facebook. I think that's where you're watching it. But Jake opened up a store in Modesto, California, where he sells CBD oil. Again, he was watching a Facebook Live of mine. He decided to jump in, and now he has a store where he sells CBD oil. So he's kicking butt. All right, let me just see if I have a couple more. What are your thoughts on ECS, the endocannabinoid system? Do you have any?
On the ECS?
Yes, ECS, the endocannabinoid system in our body.
Oh, just that. I see.
Yeah.
I love it. I really love it, especially because I was describing this to a patient today. What I love about this natural system is that if you imagine in my world, okay, revisiting my universe, I know it's got a host of these other benefits.
Yep.
But in the world of pain, let's just envision that our destination is pain control, the better life, all the things that life would be if we weren't struggling with pain all the time. Mm-hmm. That is always our destination. But how we get there, you have to choose a road, right? And we've been so dependent on the path of opiates, these narcotic pain medications to get there. And I almost can't envision a road that's more problematic than that. Mm-hmm. Every nook, cranny, off-roading, cliff, dive, ocean, anything that you could try to get through, that's what the mu receptor system, which is where the opiates work. That's how it gets us to that destination. It's the worst road you could take. It's so difficult to explain. And for me, so far with the endocannabinoid system, you're headed for exactly the same destination on sort of a superhighway. Now, it's a superhighway for some people. It's not a superhighway for all people, but it's at least a smoother road in my experience with all of them. Hmm. So, you're not dealing with, I was going to show you briefly, if you don't mind. When I put a patient on an opiate in my office, I actually have them fill out this homework sheet. So you don't need necessarily the details, but that is an entire list of just kind of the top 20 things that happen that are pathologic in a human system when a patient is on opiates long-term. So, and the interesting thing about it is that addiction, withdrawal, dependence, those are at the very bottom of the page. Ahead of that are a bunch of those other really big words that we talked about before. Yeah. So, but the long story short is that they can actually, opiates make your pain worse as opposed to better. It actually amplifies your perception of discomfort. It's actually directly neurotoxic, which means it's damaging to the nerves. It dysregulates your endocrine function. So everything from your thyroid to a man's ability to make testosterone gets all out of balance. It creates sedation, gastric issues, the list goes on. So the ability to use a type of medication that uses the endocannabinoid system, which avoids all those problems and still gets you to the same destination, that's ACEs.
Wow. That was worth the money right there that I paid you to be on the show. That was awesome. That was good. And
if something puts this good of a tool in my toolkit, and I can help my patients with something like that, I'm pulling that tool out first all the time.
I just got the chills. All right. Rich Moore says that I used to work one building over from Kaylea on North Outer 40.
Really? Del Mar Gardens buildings?
It's possible.
Yeah.
I have no idea. Let's see. Hold on. Let me just.
I'm willing to connect.
Yeah. Well, all right. I'll connect you guys.
Sorry.
I'm glad he's married. My son is 16.
I'm very married too.
I know. With twins.
Yeah.
Beautiful twins.
All of it.
You guys take some good pictures. Do you have like a professional photographer following you around? Because every one of your pictures is amazing. incredible pictures. So Rebecca Arnold says, my son is 16, vented.
Trached, G-tube,
Yeah.
severe epilepsy. CBD changed his life, yeah.
Wow.
Yeah, so ventilated means, so he had the trach, which is, he was breathing through a tube that went through his neck on a vent, so that was breathing for him. And a G-tube is actually like a direct tube that goes straight into the stomach for feedings. Wow. Right. And CBD helped him. That's remarkable. What a great story. Thank you for sharing that.
How do you figure dosing for a 16-year-old?
Great. So this is a question that I get a lot. And to my knowledge, there's absolutely no standardization. Actually, Andy and I had this conversation when we were first talking about using CBD oil. And so I was telling him that I have found the most success with using a protocol that I found coming out of Australia and another one coming out of Europe. And the protocol was really pretty straightforward. And it was acknowledging that, like we were saying, like no one thing works for everybody. And with CBD oil, especially because the brands differ from the strains of hemp that's used and how it's harvested and everything, that you really just, when you find a brand that works for you, or how to find what works for you, you start low. I would say 10 to 20 milligrams typically, once or twice a day. And the protocol that I follow based on these outlines that I found from overseas were that you could double it every 2 to 3 days. So if you started with 10 milligrams and didn't notice an effect, every 2 to 3 days, you could go to 20. And if in 2 to 3 days, you just weren't noticing an effect yet, you could go to 40 and so on. Those protocols did tend to top out at 200 milligrams in a day, which sounds really, really high for some people. But I know that's the protocols that they had. So I've only had 1 or 2 patients in my clinic actually get up to like the 150, 200 milligrams per day range. One of them found that they had benefit and just really had to stay up there as far as the milligrams were concerned. The other person, I had switched brands and found benefit actually at a much lower dose. So I think that just kind of speaks to the bio-individuality of it.
Great.
So that's what I would suggest.
Okay. I heard some other people talk about some other ways of administering CBD oil besides under the tongue. What's that called again?
Sublingual.
Sublingual. I almost beat you to it. And then on the skin, somebody talked about using it in an enema. Have you heard anything like that being done?
As an enema?
Yeah, putting it in the enema water.
I haven't heard of it used as an enema, but from an anatomic standpoint, that would make sense. Really? I do know that they come as suppositories from certain companies as well. So really? it's just playing on the fact that that's a mucosal surface. So any type of an enema or a suppository would be transrectal. So just like the inside of the mouth is a mucosal surface, and it absorbs really quickly, very directly. So the tissue in the rectum is similar to that. So for example, some of these patients, maybe like HIV, like advanced HIV/AIDS patients, and they have mouth sores or their GI system doesn't work very well. And if they have diffuse pain, meaning that it's all over the body, then they can't just, rub it in the spot where it hurts. They need something that's taken systemically so it circulates through their whole body. So the rectum can sometimes be kind of a perfect place to get it someplace where it's really absorbable, where it goes into the whole system without having to use like the upper GI tract.
Wow. We have to, I'll look into that. I don't know if I think I did share, but I have a little dose of prostate cancer. And that's kind of what got me started into trying it, because that's what I was trying to address. The side effects that I had were better sleep, less, lowered my blood pressure, no incidence of anxiety. I have a little PTSD from being a police officer that I've struggled with for years. That's virtually gone. Pain in my shoulder and my neck, gone. So those are all side effects that I've had.
Wow, you're all beat up.
Well, playing hockey for years, pole vaulting, being a police canine trainer for years.
So you were either going to use CBD oil or we were going to put you out to pasture. Those were the options.
Yeah, I would have to do this, lay out there and like move like a worm. But I wanted to share something towards the end here, because I don't know, hopefully not everybody's watching, but I got an MRI the other day from my prostate and it came back normal. So I don't know what that means. I'm just telling you that.
Well, it doesn't sound bad.
No, I'm kind of excited to see, but we're going to have a biopsy to see what the true, answer is. But they said one of the best MRI guys that they know of, at least in Kaiser, which isn't saying that much sometimes. But it said that it came back normal. So if I could just get some positive thoughts that actually is a good sign. I'm not sure, but it sounds fairly good. So we're gonna go along with that.
Coming back negative is positive.
Right. Yeah. And so that's the reason I was thinking, I go, maybe if I got closer by using the suppository or enema, that's kind of the reason why I brought up the question, is that, I mean, that's closer to the place, but that doesn't always mean that's where you need to go. Right.
Yeah. I don't know that translates or not, but if the idea of using a suppository or an enema just appeals to you, who am I to judge?
Somehow I knew that was coming. That's why I like you. All right.
It's not the area of medicine I went into specifically. Literally.
All right. I'm going to attack a couple more because I know your time is valuable and I don't want to take it all up. But this has been too good, almost too good to quit. But here, let's see. Is there one type of CBD oil, or is there different strains for different types of pain?
Is that for me?
Sure. Not
or
for me.
More on the use side of that.
Yeah, I'm like the alley guy. I'm not the guy in the alley that uses CBD oil. You're like the real deal.
So, clearly there are lots of different kinds of CBD, and that's sort of why I do have some of my patients shop around if they don't love what they tried first, because unlike synthetic medications, which are standardized because down to their very chemical components, they're created in this lab, that lab, China, India, and shipped here, and they all look alike in the same little white pill. So there's standardization there, and that's one theoretical advantage of the pharmaceuticals like that. And I suspect that more standardization will come as CBD oil gets more and more popular. But for right now, even I'm having to weed out, the snake oil salesman. That's when something gets popular, and even though it really, really works, everybody tries to jump in, especially if there's, sort of a lucrative component to it. Yep. And that's unfortunately kind of the human nature. But I think that's why it's so important to be having discussions about what your expectations should be, so that if you're not getting what you're asking for, and that how to spot the good guys from the bad. Right. So, but to directly address the question, there are many different strains. And I think even HempWorks, I appreciate that on the website, even it specifically cites where the plants are grown, how they're harvested, that they're non-GMO, that they're organic. And I think all those things are really important, because that's not true of all the products that are available. And I think that, just like it's important to know what you're eating, where it came from, this is something that you're using, that you're putting in your body for one reason or another. You need to know where it came from and understand that, yes, there's variability, and finding something that you trust is really important.
I agree 100%. I love HempWorks. I love what they do. And the owners communicate well. They get back to me right away when I've asked questions. And so right now, I think it's my company of choice based on everything that I've read about the other companies. And so I appreciate you saying that. I really do like them a lot. So we're gonna close out here, but I want to show you this last comment from April, and I'm sure I'm going to leave a couple questions. But Kaylea, if you don't mind looking at this a little bit later on, if there's some questions, if you wouldn't mind. Taking a look, and maybe you can answer them in a comment. But April said it perfectly. I love how uninhibited you are in sharing your experience as a medical professional. Many in the medical profession would not be so forthcoming about the positive effects of CBD oil. And I think that says everything as to why I thought you were going to be perfect for an interview today. And I really do appreciate it too.
Well, April, that means more to me than you could really know. That's very, very important to me. I really have to actually give the credit to my patients. My ecosystem over the years has been that my patients have been very supportive of me too. We work in a very collaborative way. And it's been easier and easier for me over the years to be just very transparent. That has served me well as a provider and as a partner for my patients and helping them get well. So I appreciate you saying that, but it has come by way of being supported by my patients too, and being able to find out that that's something that would really benefit them. And just the more clear I am with them, the more they help me help them. And that's really the most important part of it.
And I got to answer this question. Fibromyalgia, that's been coming up a lot in the stuff that I've been reading in testimonials. Have you found?
I've had multiple patients in my clinic with fibromyalgia that have benefited from that. I would also, when it comes to fibromyalgia though, my primary recommendation would be to really, really, really put your nutrition under a microscope. I've seen nearly all fibromyalgia patients in my clinic, when we work together really closely, remediate the greatest proportion of their symptoms by dialing in whatever it was about their nutrition that was wrong for them. So now, if the CBD oil may be meaningful as far as reducing your symptoms, and I think that's worthwhile so that you can be more active and have a higher quality of life. But what we're really looking for are not only significant benefits, but sustainable ones. And I think that means that you need to mine down to the foundation, which is probably in your nutritional profile.
Awesome. Were you impressed that I was able to say fibromyalgia?
No. No, that's not
Come on. I had to practice that for about a month. I have.
Supercalifragilisticexpialidocious.
Oh my gosh. Dr. Awesome, I love you. Thank you for coming on. I really appreciate it. This has been a blast. And
right.
And I hope we could do this again. And I hope you don't mind me bugging you. I know the audience is going to want, this is probably the most engagement that I've had on any broadcast that I've done. And this is my 220th with Be Live. I think I've done probably 300 Facebook Lives and interviewed a large number of people. And you are the most engaging, the most informative. And I just really appreciate your time. And I know that it's valuable.
Good. Well, I think you had the crowd at anesthesiology.
Oh my gosh.
Right. We were set from there.
This is awesome. So don't go. So you, Dr. Awesome, don't go away. I'm going to end the broadcast here in just a second, but stay on so that I could say goodbye to you. I only have like 10 seconds left on my phone battery, but to all of you that have been watching, again, just know that my purpose for doing these isn't for you to buy your CBD oil from me. You can if you want, but it's not. I want you to understand how CBD oil can benefit you. I want you to benefit you. I want you to do your own research and find out what type of CBD oil is best for you, which one is good. Understand that I did do quite a bit of studying about the different companies and found HempWorks to be the best for me and what I look for in a company. And so I do think they are the best. But again, this isn't about you buying from me. You don't have to. I buy from somebody else. There's other people that are on this. Buy from them, or do your own research and buy from somebody else. I think that it's something that you should try, even if you're healthy. I think it'll benefit you in the long run. So just understand that this isn't about making money or from you buying from me. All right. So, and again, I just want to say thank you to Dr. Kaylea. Could you say your last name so I make sure that I feel comfortable saying it?
Boutwell.
Oh, good. I'm good. All right.
You did great. And Andy, thank you so much. And thanks for saying that, because I'm really proud to be on your show because that's your perspective. It's about getting the information out there. And I couldn't agree more. So I'm proud actually to be able to put my message on your format.
Thanks. I appreciate it. All right, to everybody. And thank you, Matthew, for helping out with some posts. And Laura, I think you also posted some good stuff on there. So thank you again. Have a great week, and I will see you on the next one. Take care.